Children cough endlessly everywhere. That's a fact. It's one of the commonest reasons for children to be brought to my outpatient clinic or to the emergency department for that matter. I'm going to talk to you a bit about what's normal in childhood cough, what's abnormal, and what are the key features that should make you seek help. The things that I describe towards the end of this talk are incredibly rare. I'm not here to scare you, I'm here to reassure you that what your child is doing is probably normal. What's a normal cough? Healthy 10-year-olds will have around 11 bouts of coughing in a normal 24-hour period. That's healthy. Young children will have up to 12 colds in a year. When children get a cold, they will cough for 2 to 3 weeks. With that in mind, you can imagine that it's difficult to find a point when they're not coughing, and that's normal. So how do you treat a normal, bog-standard cough? Well, the first question is, do you need to? Most children with a cold will cough for 1, 2, maybe 3 weeks, and then they'll be fine. And actually that cough will be part of the way in which they clear the chest of any secretions that are causing irritation. If your child is coughing to the extent that they're getting no sleep, that they're in pain or significant discomfort, or they're vomiting all the time, you may want to do something to relieve those coughing symptoms. And at that point, it's reasonable to give them an over-the-counter cough syrup. You need to recognize that these aren't going to make your child better any sooner, but they may make them feel a bit more comfortable. The other thing, paracetamol, ibuprofen, again, over the counter, can relieve some of the pain associated with coughing. So that's a normal cough. What's abnormal? What should get your spidey senses tingling? Well, thankfully, the most common causes of an abnormal cough are still not too worrying. Your child may have a bit of gastroesophageal reflux. That's when stomach acid comes up from the stomach up to the upper airways and irritates the airways or the vocal cords and makes them cough, particularly at night or on exercise, and actually sounds a lot like asthma. Persistent bacterial bronchitis is a name for a low-level bacterial infection which causes your child to have a wet cough that just doesn't go away even between colds. There's also a quite unusual cause for a persistent cough. We call it habit or psychogenic cough. And it occurs in a context where children look very well, and yet they cough and cough and cough. What's odd about this cough is that it's much more prominent in the daytime, and they hardly ever cough at night. They cough an awful lot more in front of their parents, particularly if their parents are worried, or in front of a paediatrician, but they won't really cough when they're having fun. Quite often they won't cough at the weekend, and they won't cough if a nurse is watching. The key thing is, if a habit or psychogenic cough has been identified, don't worry. The answer is calm indifference, reassurance. Don't talk about it, don't notice it. It will go away. So let's talk about asthma. So asthma is a condition where we have reversible narrowing of the airways. What that means for your child is wheezing and coughing, quite often in response to a virus or exercise, and the cough is particularly prominent at night. Thankfully, most children with asthma are readily controlled on inhaled steroids or a blue inhaler, and you'll have seen these before. And the key thing is, if it is asthma, it gets better with these treatments. So we've talked about abnormal cough. What then are the key red flag features that should make you seek an urgent paediatric opinion? We've talked about a wet cough that doesn't go away, but if you add to that a child that has also had severe breathing difficulty, maybe at birth, has had a runny nose since birth, and maybe gets recurrent chest infections, these may be a sign of immune deficiency, so a weakness in the immune system, or more rarely a condition called PCD, or primary ciliary dyskinesia, where the hair cells that line the upper and lower respiratory tract don't waft mucus out effectively. And I guess the final red flag you'd like to look out for is a child whose cough is worse with eating and drinking, or perhaps doesn't like to eat and drink. Maybe the child who vomits a lot and has done severely since they were born. This child may possibly have cough related to aspiration, that's passage of food and drink into the lungs, perhaps through an abnormal connection between the breathing tubes and the feeding tubes, something we call either a fistula or a laryngeal cleft, or perhaps due to severe gastroesophageal reflux. So at this point, I think it's probably helpful to go back to where we started. Children cough. It's what they do. It's normal, it's even healthy. If you have doubts based on anything that I've said, that's why you have a GP, that's why we have paediatricians. Thank you for watching. I hope that that's been informative. Please do subscribe to the YouTube channel for more content on this and other childhood subjects, and we'll see you soon.